Good morning and welcome back to my channel. My name's Diana. Today I will be talking about blood cancer, as there is a lot of it being talked about on different social medias like Instagram, TikTok, and the reason for this video is I want to make people aware of this cancer. It's not talked about very much, and there are several different types, one of which I will be going into today, and I will be giving a trigger warning right now because I will be talking about bleeding on the brain, discoloration of your poos, and of course sex. These are just some of maybe the symptoms which I will be going into shortly. And I know I have done a couple of videos on cancer, but cancer is a very scary word. It's a nasty disease, and we need to make everyone aware of all the different types of cancers out there. I will be leaving links in my description box below, so please take a look. And cancer, as well as other charities, are very close to my heart, but especially cancer. And as you know, and you've seen my previous videos, one of them is pancreatic cancer, and I will be trying to get this message across and help cancer charities as much as I possibly can. Anyway, let me get into the video, and I will be reading the notes from a book that I've written everything down, as there is a lot to take in. Now, to start with, let's talk about what blood cancer is. Now, this cancer affects blood cells. There are different types of blood cells or blood cancers, such as leukemia, lymphoma, myeloma. There are also types called MPNs, which is myeloproliferative neoplasms, or MDS, which is myelodysplastic syndromes. There are other types of blood cancers, such as Hodgkin's lymphoma or non-Hodgkin's lymphoma. The types of leukemia is chronic lymphocytic leukemia, which is other name for it is CLL, or the one I will be talking about today is acute myeloid leukemia, which is AML. Actually, that isn't the one I'll be talking about. The one I will be talking about is ALL, which is acute, bear with me while I find it, acute lymphoblastic leukemia, which is actually the one I will be talking about. Now, the causes of blood cancer is caused by mutations or changes in the DNA within blood cells. These changes causes the blood cells to start behaving abnormally, and in most cases these changes are linked to things we can't control, and they happen during a person's lifetime. So they are not generic faults you can pass on to family, and also some blood cancers can affect children. Now, statistics of blood cancer, not specific blood cancer, the specific blood cancer I'll be talking about, but overall, over 40,000 people are diagnosed with a blood cancer each year in the UK, and 250,000 people are currently living with blood cancer. And treatments can be different between adults and children. Causes, again, is We don't know why someone will develop blood cancer. These are things that we need to get scientists to investigate, but they do know that some of the risks are age, your sex, ethnicity, family history, radiation or chemical exposure, and some health conditions and treatments. How these factors affect the risk depends on the type of the blood cancer. Now, some of the symptoms are weight loss, bruising or bleeding that's unexplained, lumps or swellings, breathlessness, drenching night sweats, infections that are persistent, recurrent or severe, a fever that is 37.5 Celsius or above that is unexplained, rash or itchy skin that's unexplained, pain in your bones, joints or abdomen, tiredness that doesn't improve with rest or sleep, paleness, which is the skin under your eyes or eyelids looks white rather than pink. Now, as I said, the actual blood cancer that I will be talking about is acute lymphoblastic leukemia, or ALL. Now, this is a type of leukemia where cancerous cells build up in the bone marrow until eventually there's no room for normal blood cells to be made. ALL develops quickly and needs to be treated immediately. As soon as you notice any signs of abnormalities, you need to go and see a doctor. Around 800 people are diagnosed with ALL in the UK each year, and it affects not only adults but children more than adults. The blood contains 3 types of cells. There is the red blood cells, which contain protein called hemoglobin, which carries oxygen to all the tissues of the body. Muscles and other tissues need oxygen to use the energy you get from food. White blood cells are just as an important part of the immune system. Their job is to help fight and prevent infection. There are different types of white blood cells, including lymphocytes, monocytes, and granulocytes. And then the third one is platelets. These stick together and form clots to stop bleeding. If, for example, you have a cut, it will stop the bleeding. ALL affects cells called lymphoblasts, or blast cells in your bone marrow. These are a type of white blood cell, which are a vital part of your immune system. Lymphoblasts normally mature or develop into lymphocytes, which fight infection. Your body needs lymphocytes all the time, and it usually makes the right amount. However, when people have ALL, this process goes wrong. The blast cells multiply and very, very quickly, and they don't develop properly. These are cell leukemia cells. When this happens, they build up in the bone marrow until there, as I have said before, no room for normal blood cells to be made. So your body doesn't have enough white blood cells, red blood cells, or platelets to work properly. This can then lead to a variety of symptoms. ALL, or as I say, acute lymphoblastic leukemia, develops more quickly than some other blood cancers. So fast diagnosis and treatment are very, very essential. Common signs of ALL are fatigue, extreme tiredness, which won't disappear with rest, as I've said in the previous list. It's caused by a low number of red blood cells in your blood, and this is also known as anemia. Anemia can also make you feel breathless even when resting and lead to chest pain. I should have said at the beginning, I do not want to scare anyone, but if you do notice any changes or any of these symptoms and you don't know where you got them from or what's caused it, please get your doctor to check you out. Do even try and definitely see your doctor and get professional opinions, and fight if you don't agree with what they're saying. Get a second, third, fourth opinion. You need to be correctly diagnosed. Carrying on with the symptoms. Bruising and bleeding. This is also caused by a low number of platelets in your blood. Platelets are the blood cells that stop the bleeding by making blood clots. A low platelet count can mean easy bruising, bleeding from gums and nose, bleeding from wounds which is hard to stop. Another symptom, and I'm sorry about this, is black tarry poos, or poos that are streaked with red because of bleeding in your gut. You can get headaches, difficulty speaking, or difficulty moving parts of the body because of bleeding into the brain. Infections can be caused by low number of white blood cells. Low white blood cells can lead to infections and fevers that last longer or happen more often than normal. Weight loss, which can or is a symptom for quite a lot of cancers, including pancreatic. And the weight loss is caused by high metabolism, which is the rate you burn energy from your food. Unfortunately, scientists don't understand completely why the metabolism speeds up in people with ALL. Other symptoms: your lymph nodes or glands are larger than normal. You may notice those in your neck. However, they can show up in several other places around your body, such as under your armpits or your groin. Your doctor may also feel a swollen liver or spleen, the organ that sits under your ribs and filters your blood when they examine your stomach area. In T cell, ALL, swollen lymph nodes in the chest, might show up on an X-ray. It is important to remember that many of the symptoms seen in ALL can also happen in people who have common conditions, which are less serious. Even though leukemia being rare, the symptoms are common in other diseases. It can sometimes take 1 to 2 weeks to diagnose. However, if your doctor suspects leukemia, they will act quickly to make sure you get the tests and treatment needed. The prognosis survival rates in adults is lower, but they are improving than in children. The 5-year relative survival rate for ALL is 68.8%, or 30 to 40% in adults and 90% in children. Treatment for ALL. The main treatment for ALL is chemotherapy, but depending on your subtype of ALL, you might have another treatment. This you can ask about when you see your doctor for further talks or But this might include targeted cancers, stem cell or bone marrow transplants. Some people may have their treatment as part of a clinical trial. As I've just said, you can find out more about these other treatments when you have a follow-up appointment with your doctor. I know I've said this at the beginning, but please, and this is very, very, very important, any signs of any of the symptoms I have mentioned, if you feel unwell in general, please go to your doctor. Please get yourself checked out. We need to not be scared of the word cancer. We need to spread the word of cancer. The more we speak about it and the different types of cancer, especially the ones that aren't spoken about so much as like blood cancer, we need to talk about. We need to get it out there, and this is what I want to use my YouTube channel for. Anything to do with mental health, as I said in my previous video, mental health, charities or illnesses like cancer, dementia, anything that needs to be brought forward, needs to be spoken about, to stop it from being such a taboo subject and so scary. The more we talk about it, the more the scientists and the more we can help, the more in research, the more the scientists are going to be able to help us survive the cancers. Since losing my dad in 87, I know the cancer treatments are getting better, but we still need that research. The research will never go. We need it to happen continuously. And I just want to urge everybody and anybody that doesn't feel themselves, and I will stress this, and how important it is to always get, or at least try and get, an early diagnosis. The earlier the diagnosis, the more likely the survival rate. And as I said at the beginning, I will be leaving links in the description box below, so please take a look. And it would be just having a look and reading further information. I got this information when I typed in blood cancer into Google, and as I say, I have got this information also from the link which I will be leaving in, which is the Blood Cancer UK link, and I will be leaving that information also. I do appreciate everybody that watches my videos. If you have any other ideas, then please leave a comment, like, subscribe. It's free, and just share, just so we can get the word out there. And thanks for watching. You are all amazing. Don't forget that. And stay vigilant, and any signs, go and see your doctor. Until next week, thanks for watching, and I love you. Bye.